Hello, my name is Dirk Larson, and I'm a biostatistician at Mayo Clinic. In this short video, I will discuss how to avoid systematic bias in orthopedic research. Observational studies in orthopedic research are subject to several sources of error. Error can be either random or systematic. While random errors are unavoidable, systematic errors are avoidable. They can be reduced or eliminated through appropriate study design and data collection strategies. Sources of systematic error or bias broadly fall into three categories: confounding, selection bias, and measurement bias. In this video, we will focus on confounding and selection bias. When confounding or selection bias is present, the observed association between exposure and outcome is distorted from the true relationship. Often, the primary goal of a study is to quantify the strength of the relationship between the exposure and the outcome, controlling for other factors. Common exposure variables of interest in orthopedic research include surgery type, surgical indications, implant type, or medical interventions. Common outcome variables include surgical complications, revisions or other reoperations, readmissions, and patient-reported outcomes. Other factors or variables that may need to be evaluated and accounted for are baseline variables such as age, sex, comorbidities or past medical history, and post-exposure variables such as manipulation under anesthesia. The most common types of additional variables controlled for in analyses are confounders, intermediate variables, also known as mediators, and collider variables. Let's look at each one of them individually. A confounding variable distorts the true relationship between exposure and outcome if not adjusted for in the analysis. Common confounders in orthopedic research include age at surgery, sex, body mass index, surgical indications, arthritis severity, and comorbidities. A confounding variable is associated with both the exposure and the outcome and occurs before the exposure, or it is measured at baseline. For example, age at surgery is a confounder of the relationship between implant type, the exposure, and revision risk, the outcome, since age at surgery is associated with both implant selection and revision risk, and it is measured at baseline. If data on a confounding variable is collected and available to include in the analysis, it is called a measured confounder. If it is not available to include in the analysis because it was not collected, it is called an unmeasured confounder. If a variable meets the definition of a confounder and it is not included in a model for any reason, the estimated association between the exposure and the outcome will be biased. This type of bias is called residual confounding. Registry databases are foundational to orthopedic research. However, registries collect information on a limited number of variables. Therefore, registry-based studies can be affected by residual confounding. For example, if the exposure of interest is fixation type and the outcome is revision, obesity is a confounder of this relationship. However, BMI is not usually collected or is mostly missing in many registry databases. If we do not have BMI measurements, then we cannot adjust for it in a statistical analysis. The measure of association we estimate between fixation type and revision is limited by possible residual confounding by BMI. There is no statistical method that can be used to test if unmeasured confounding exists. However, sensitivity analyses can be performed to determine how much an association could change under different degrees of unmeasured confounding. There are several statistical methods to adjust for measured confounders. These include multivariable adjustment, inverse probability weighting, restriction, matching, stratification, and other methods. A mediator is a variable that is affected by the exposure and then in turn affects the outcome. It is associated with both the exposure and the outcome, and it occurs after the exposure but before the outcome. Common mediators in orthopedic research include post-surgery or perioperative variables such as dislocation or surgical complications. For instance, when examining frailty as the exposure and readmission as the outcome, postoperative complication is a mediator variable. Mediators are frequently mistaken for confounders. It is incorrect to adjust for mediators in the statistical analysis. For example, if the exposure mediator mediator outcome, and exposure outcome associations are all in the same direction, just like in this example, controlling for the mediator results in an estimated association that is smaller than the true association between exposure and outcome. A collider variable is a common effect of both the exposure and the outcome. It is associated with the exposure and the outcome, and it occurs after both. For example, consider a survey-based study examining education level as the exposure and revision surgery as the outcome. A possible collider is voluntary participation. Patients with higher education are more likely to participate, whereas those who had revision surgery may be less likely to return the survey, and selection into the study occurs after possible revision surgery. Adjusting for a collider will introduce collider bias. The most common type of collider bias is selection bias. It occurs when both the exposure and the outcome are associated with the selection of subjects for a study. Selection bias results from selection of a study sample such that some individuals are more likely to be included in the study than others. When selection bias is present, the observed association between the exposure and the outcome in the study is different from the true association in the target population. Selection bias in orthopedics may arise due to informative dropout. This occurs when individuals who are exposed are more likely to drop out of a study. Self-selection into a study. This occurs when people who previously experienced a surgical complication, for instance, are more likely to volunteer in a study related to their complication. And finally, selection bias occurs when hospital-based controls are selected instead of population-based controls. An example of selection bias in orthopedic research is the obesity paradox. Even though obesity is associated with an increased mortality risk in the general population, overweight and obese arthroplasty patients do not necessarily have a higher mortality risk compared to their normal weight counterparts. Why is that? The answer resides in the fact that obesity is associated with numerous adverse health outcomes and a higher mortality in the general population. Obese patients who survive long enough to undergo surgery are more likely healthier, paradoxically making obesity seem protective among arthroplasty patients. To account for selection bias, we need to consider the probability of being selected into the study sample. If you suspect selection bias, consider standardization, inverse probability weighting, or stratification to account for it. So, what questions should be asked to help identify and avoid systematic bias? Here are a few. 1. Is the data source for the study suitable in terms of sample size and representativeness? 2. Are all exposure, outcome, and other potential confounder variables available in sufficient detail and accessible for the study? What variables are included in the analysis? Are the same variables adjusted for in all models? How are these variables chosen? 3. Is the duration of follow-up and the time between exposure and outcome sufficiently long for the type of outcome? Did the investigators define the timing of outcome relative to the exposure? 4. Are there any unmeasured confounders? If so, is this acknowledged? Is any reasoning given to how this unmeasured confounding affects the results? 5. Are any post-treatment variables, in other words, mediators, used as adjusters in the analysis? If so, is mediation analysis the goal of the study? 6. Is selection bias likely? If so, has this been noted as a potential limitation? In conclusion, investigators should be careful when selecting the variables to include in a statistical model. Bias can result if confounders are incorrectly not adjusted for, or if colliders or mediators are incorrectly adjusted for in the analysis.